Okay, yes, first of all, welcome and wishing you a very afternoon. So, before we start with anything, first of all, I would like to know your name as well as it's been how many years since you've been practicing?
I'm Dr. Sabnis, and I'm working as a chairman and head of department at Muljibai Patel Urology Hospital, Nadiad, and I'm the immediate past president of USI, and I've been doing urology practice for more than 35 years now.
That is something very
Yeah, I'm Dr. Rajesh, but I am the owner and the CEO of hospital called MIB Hospital in Mumbai. And at present, I am the president of Mumbai Urology Society and into the practice say for about almost 30 years.
my God. So it's pleasure meeting you, obviously. So let's start. We're gonna be having questions on BPH. So first question is, what according to you is the best treatment for BPH, and what is BPH exactly?
Yeah, as age advances, the prostate enlarges, and if it causes symptoms, if it obstructs the urethra, then that's called as benign enlargement of the prostate. And classically, in the beginning, it has to be treated by the medical management if it is caught early. There are so many medications which are available, and they give fantastic result. However, in spite of medications and in spite of all this thing, or if it is neglected, then obviously at the end you have to go for the surgery.
That's all. I mean, as what Dr. Sapnesh mentioned, that it is a disease which is related to the age. And if it's neglected only, I mean, the results are not very good. Otherwise, either the medical line of treatment or the surgical line of treatment, as per the right indication, will give a very rewarding results. So anybody who has the lower urinary tract symptoms should immediately consult the urologist, say after the age of 55, 60. There are certain other tests also regularly which has to be included in their yearly health checkup related to prostate, and that all will provide a very rewarding results if they are very particular and regularly visit their urologist.
We can count that as a modification as well, right? Yes, to the measures, to precautions. Yes. Okay, heading towards the next question. What are the complications that could develop if BPH is not diagnosed early on? And can you also share few instances that you have come across your practice? So first over to you.
As I just mentioned to you, that if the prostate enlargement disease, which generally occurs after the age of 55, 60 and troubles the patient as the age advances, the percentage of patient getting the symptoms because of the enlargement of prostate also do increase. However, in the early age, in the early stage, the patients, they don't realize, they consider it as just and pass it off as a part of the aging process. However, any change in the pattern of urination should be discussed and consulted and to be informed to the urology doctors. Why? Because failing to recognize the disease at an early stage can later on lead to a significant amount of problems, right, which can go from, say, bladder dysfunctions to even kidney failure if not treated well in time, and if it progresses, say, much beyond the knowledge of the patient. Sometimes even patients, they do develop cancer of the prostate gland. Prostate is a gland where cancer is also common, not very uncommon, and it increases, the percentage increases with the increase in the age. And with a simple test, as I mentioned, that some simple blood test which is in a yearly health checkup if included, can diagnose the prostate cancer at a very, very early stage and can be completely cured, 100% cure.
Yeah, I think what he has narrated is all right, but the prostate, if it is neglected, the symptoms are not addressed to, can cause poor flow, deterioration of flow. Their lifestyle is disturbed. They have to get up multiple times at night. They have to get up they can't control urination. And over a period of time, sometimes they can land up with acute retention of urine. Sometimes they can land up with chronic retention of urine. The bladder power will go away. The pressures on the bladder will get transmitted to kidney. The kidney swelling will come. The kidney will not function well. So all these consequences will occur if it is not addressed to. And therefore, I think you are doing a good thing that you are creating the prostate awareness, which even as of today, even in the metro cities, the people are not aware of. And it is very important that awareness should be created, because all these complications, stone formation, all these things can be avoided just by simple awareness and a very simple treatment.
Okay, last but not the least, what are the lifestyle modifications that are must for people the age of 40 to 50? they can avoid to BPH?
Yeah. There is nothing much to avoid BPH. BPH is bound to occur, but only thing is that in the initial period when the enlargement is just beginning and the obstruction is just presenting, the lifestyle modification in the form of drinking less water at night, going frequently for urination, voiding twice, the double voiding, all these measures, if you take in the early period of your problem, then you may not need even the medical management and you can prolong that. So that can be but there is no way that you can prevent the enlargement of prostate. It is like how to prevent the aging. It is not possible. You have to just overcome whatever happens.
Like in medical science, we always compare it, when the patients invariably ask that, what do I do to avoid the disease itself? But as sir mentioned that, it's an aging process. So I always compare it with the cataract. Cataract people understand it very easily. Prostate they don't see, so they don't understand. And they are all aware that cataract doesn't occur to everybody, but it occurs to many and increases in incidence with the aging age, with the increase in the age. The same way prostate also, behaves more or less the same in relation to the age. And as the cataract cannot be avoided, and finally the treatment is operation, as we know, and as the patients all are aware, mostly in the case of prostate also, medical managements of course are there, unlike cataract. But failing at that, they do require operations, and it's a very rewarding operation if done well in time.
So one more question I would like to add up, just so because experience plays a major role. So any message for all the upcoming urologists?
The message to upcoming urologists is that a prostate problem has to be understood well. Then medication is the key part, and if medications fail, proper follow-up is required, and if it fails, then surgery is also important. Art of surgery has to be learned. There are many methods of doing surgical removal of prostate, but what is suitable in that particular patient should be studied properly, should be trained properly, should be understood properly. So that's the message to young urologists.
Besides all these, I would say for young urologists, when I thought it will ask me about patients, but that's a very valid point that all the urologists, young urologists, what they should do is that they should not only make such awareness programs and participate in that, talk to the people in society in different forums. One very important thing I would like to say, which I have already done in my practice, and it has helped many patients, is that I have put up the standees mentioning about almost all the symptoms which are related to prostate, and patients who come for other diseases or the relatives of some of my patients, they say, अरे इसमें से मुझे भी 5-6 चीज हो रहा है, या मुझे सब कुछ हो रहा है, या मुझे 2 चीज हो रहा है. So doctor, what do I do? Otherwise they would not have consulted a doctor. But knowing that and reading those with a picturesque presentations, they do come and ask me, doctor, I think should I also investigate? Should I also take your consultation? And yes, that is how they become aware. So the concept of early diagnosis, early representation, I think it does help. All urologists, especially the young urologists, can take this up as one of the agendas in their practice. Besides the routine treatments, public awareness, as we call it as.
So well, that's all. Thank you very much for your